Snap video for Group 7 with Grace. So she presented to the clinic with her mother, independently ambulating using a posterior walker. She's an 8-year-old child with spastic triplegic cerebral palsy, which affects her both lower legs and both lower extremities and her left upper extremity. Play was used to assess transfers, walker to floor and chair to walker. Floor mobility, bed mobility, static postures were also observed in tall kneel, half kneel, standing, and sitting. Mobility in supported tall kneel, walking, and standing was also assessed. Spasticity was noted greater in lower extremities than upper extremities.
All right, so when we looked at some of the main impairment areas for Grace, really came up with her postural control and sitting, just trying to maintain a more upright posture. She has some difficulties with transfers, getting from her walker down to the floor. She kind of just falls to the floor instead of using more of an efficient half kneel position. She has difficulties maintaining upright ambulation when she's walking with her walker, and we want to get her to maintain that half kneel position again, just to facilitate a better position for those transfers. When we tried to break it down, our main problem area, we decided on Grace's decreased mobility in upright ambulation when she's walking and in tall kneeling, and that's just going to facilitate more interaction with her environment as she gets older and is able to move around a little bit better.
Upon discussion with Dr. Lundin, our instructor noticed difficulties with patients' ability to maintain upright posture. This was especially noted during ambulation and mobility. Maintenance of half-knee position to facilitate knee to stand transfer for efficiency and safety was also noted as difficult. Assessment of trunk rotation was not specifically performed but will be included as part of intervention to promote gait efficiency and increase functionality. Adding and utilizing more floor play instead of mat time will be more natural for future sessions with Gracie.
So what's our plan? Our plan is with Grace, we're going to try and use tall kneel, half kneel, we're going to do some bridges, we're going to do static and both movement with the tall kneel, and then we also want to do work on her sitting posture, and we're going to plan to do a human board game setup where we have dots on the floor and those are our markers for how many spaces she can move forward, and we're going to do dice or a spinner where it's move 5 spaces using tall kneel, move 5 spaces after you with her walker, so she has to transition with through half kneel to get up to her walker and then go 4 spaces. We're also going to do bridges in there as well to increase that core, and then we also want to do trunk rotation, so we're going to use back-to-back with a therapist for the cueing, and then we're going to do trunk rotation game of who can pick up those mini blocks on the right side and transfer to the left, initiating that trunk rotation and the upright posture.